good morning, everyone. Thank you for being here. And it's a little colder than we would have wanted it, but being here to announce millions of dollars to help the great people of Louisville certainly will help take the chill off. As chairman of the House Budget Committee, I had the honor of introducing and shepherding the American Rescue Plan through Congress. Our goal was very simple: to provide the resources needed to finally defeat the pandemic and to make the kind of investments that will rebuild our economy, build it back better than before, and help American families cope with all of the additional burdens that the pandemic imposed on them. Today, I'm proud to say that this effort is putting checks in the bank accounts of more than 4 million Kentuckians. 4 million Kentuckians, that's 92% of all the adults and children in the Commonwealth. To put it in a different perspective, this plan will inject between $5 and $6 billion of disposable income into the Commonwealth of Kentucky, almost $1 billion in every one of our 6 congressional districts. It will provide additional support for almost 1 million Kentucky children and lift 70,000 Kentucky kids out of poverty. We funded vaccine development and distribution, increased testing capabilities, and asked our great leaders like Mayor Fisher and Governor Beshear to tell us what they needed to help them get through this pandemic and do the jobs that they want to do, and that we'd work to make it happen. But as part of our all-hands-on-deck response to this pandemic, support for those who are on the front lines of our healthcare system has been our top priority, and few have done more critical work than community health centers. All of you around here, and some of our leaders behind us who you will hear from, have provided life-saving care and support in underserved communities during the worst healthcare crisis in the country. Of course, you do that all the time, but the burden was especially large over the last year. I'm proud to be joined by those individuals here today to shine a light on the importance of community health centers as they continue working every day to vaccinate and to provide stellar care despite the fear, uncertainty, and exhaustion that they've seen over the past year. So it brings me tremendous joy to help announce that thanks to the American Rescue Plan, and the numbers are here, family health centers will be awarded $8,820,500. Park Duval Community Center will be awarded $4,352,250, and Shawnee Christian Healthcare Center will be awarded $1,086,375 by the U.S. Department of Health and Human Services. That's more than $14 million for these 3 health centers serving the people of Louisville. I'll let them talk. Yes. I'll let them talk about what that means for their centers and their clients. This kind of direct investment in our people and in our community will go a long way, and no one knows that better than our mayor, Greg Fisher, who, as president of the National Conference of Mayors, played a major role in not only advocating for our city on the national stage, but also helping manage this response throughout our community and on behalf of his fellow mayors. And I will say, as an aside, that I was part of a meeting that Mayor Fisher organized, and was hearing from a lot of Republican mayors as well as Democratic mayors that how much help they needed. They weren't successful in convincing their Republican representatives in Congress of that need, but they convinced enough of us, and so much of this response came as a result of our meetings, conversations with state and local leaders like Mayor Fisher. So I will now turn things over to our great mayor, who has governed this city and had to manage this pandemic in a very, very responsible and organized and systematic way. I congratulate him and his team on the job that they've done. And I'm now proud to introduce Mayor Greg Fisher.
Thank you, Congressman, and good morning to everybody. This is a tremendous bipartisan response. John talked a little bit about the politics behind this, But when you see over 70% of America favoring the American Rescue Plan, we know we're doing something good. This was a once-in-a-lifetime challenge for us as a country with this pandemic. And it required once-in-a-lifetime leadership to get the rescue plan through. And I would submit that President Biden did that as President of the United States, Speaker Pelosi, Leader Schumer, and the chair of the House Budget Committee. And that's our very own Congressman John Yarmouth, did an outstanding job. He keeps such a low profile, most people don't realize that, but the role and the impact that he plays in Washington, D.C. is immense, and it couldn't be a better time here for our city. So, Congressman, we appreciate you very, very much. And so you got the big picture, right? We got this big problem of a pandemic, and you got the big money coming out of Washington, D.C. But how do you get it done? You know, how do you get one shot in one person's arm so that we can start making progress against this dastardly virus? So our federally qualified healthcare centers are an incredibly important partner to make that happen. I want to thank Bill, Stan, Ann, and Michael for the critical role that their centers play in protecting the health of our community's most vulnerable. And I've got to say I'm proud of our community. The goal with the pandemic, sure, was to get a quantity of vaccines out. But if we could not get them out in an equitable way, then we were disappointing our potential as a city and certainly not living up to our values as well. So I will put our equity work up against any city in the country right now. We're doing a very good job and we got a very good plan. Our vaccination distribution task force has had equity at its front and core ever since it started. So our FQHCs are a significant part of that, and obviously they make that happen both with this COVID-19 virus, but with all of the work we have with our public health and wellness team as well. I just came a few moments ago from Whitney Young Elementary School, where Humana is opening a new West End vaccination location in partnership with the governor's office, obviously my office, the public health department, JCPS, and Norton Healthcare. And that is a full effort to make sure that people can get vaccines all over our community. And it's just another example of what we can do when we work as partners. One of our city's secret weapons is we do very well working with each other. When we have a common objective, when we have a common enemy, in this case COVID-19, we come together and we swarm it. People leave their egos at the doors, and they do that because they just want what is the best for our citizens. And one of the things I'm hoping that comes out of this is that people all over our city and all over our country get a better appreciation for the social determinants of health. They get a better appreciation for racism as a public health crisis. When you think, and there's no such thing as an average person, but demographically there is. But when you think that the average white person lives 10 to 12 years longer than the average black person, that's a public health crisis. And it was a pretty abstract notion to most people. But during this pandemic, the spotlight has been put on this issue to where I'm very hopeful that as we roll out the American Rescue Plan, the American Jobs Plan, and the American Family Plan, that our country will be able to make systematic changes to these outcomes that have plagued us as a nation for far too long. Because a shortened lifespan means shortened human potential to make a difference. Shortened joy to an individual, shortened joy to that family that everybody deserves. So our ability as a city to effectively combat this vaccine in partnership with the federal and state governments and our local federally qualified healthcare centers demonstrates that we are up for this job and demonstrates that we're up for this job of taking on the social determinants of health. So it gives me great joy to be here today to participate in this announcement and see us take more significant steps to rid our community of this virus that has plagued us now for over a year. So congratulations to everybody involved. Thank you.
Thank you, Mayor Fisher. I now have the great honor of introducing someone who I hope one day gets the universal acclamation that he deserves. The CEO of Family Health Centers, who has done yeoman's work in providing health care to this community for many, many years, put off his retirement in order to help us see through this pandemic. and we all owe him a debt of gratitude for that and his many years of service. The CEO of Family Health Center is Bill Wagner.
Good morning, everybody. Congressman, Mayor, thank you. Thank you all for being here today. This is indeed a special occasion. The American Rescue Plan and the expanded federal support for community health centers is historic. This is the largest ever one-time investment in this nation's federally qualified health centers. It recognizes the critical role that community health centers, like the Family Health Centers, Park Duval Community Health Center, and Shawnee Christian Health Center, play in protecting at-risk communities here in Louisville and across the nation. The $8.8 million that will come to the Family Health Centers over the next 2 years will help ensure greater equity access in accessing COVID-19 testing and vaccination services, building vaccine confidence, and ensuring that low-income and vulnerable people are not left behind in the fight to eradicate COVID-19. We currently operate 8 community health center sites across Louisville Metro and serve more than 45,000 individuals each year. These health centers are located in medically underserved neighborhoods of West Louisville, including here in the Portland neighborhood, downtown, and in neighborhoods generally west of I-65. These are neighborhoods that have been disproportionately impacted by COVID and where we lag behind in vaccinating the population. A majority of the Family Health Center patients are low-income, racial and ethnic minorities that have been hit hard by the pandemic. Many are immigrants and refugees from around the world and have limited English proficiency. Thousands more of our patients are unhoused, living in shelters and on the streets. These are the persons who are most at risk. Over the past year, we have provided more than 35,000 COVID tests in our labs and our 4th drive-through testing sites. And we've provided more than 2,000 vaccines thus far to patients in our health centers, in shelters, and in homeless encampments around the city. While progress is definitely being made in vaccinating our patients and reducing the number of patients and reducing the number of cases, our journey is far from over. We need to expand vaccine capacity in the months ahead to continue our efforts to reach the most vaccine hesitant among us, especially after the mass vaccine sites wind down in coming months. We need to fully integrate COVID vaccinations into our ongoing primary care services so we can provide booster doses if they're needed in the future, offering them like annual flu shots as part of the patient's routine visits. We need to expand our information systems to manage increased vaccination capacity for ordering, inventory management, reporting, communications with patients and their families. And in addition to these COVID-related services, we can use the new funds for basic primary care and preventive services, not only to maintain current services, but also to address what they call recovery and stabilization activities in anticipation of serving the pent-up demand for services that patients have been postponing needed care during the pandemic. You know, one of the many things that we learned is during the pandemic is we need to get out beyond the walls of our health centers to meet people where they are, in their homes, in their churches, in their neighborhoods. So we've expanded mobile services. We've added telehealth for medical and behavioral health care. We've established pharmacy delivery services, and we've strengthened our partnerships with other community organizations. And these are the types of initiatives that we will likely build upon and expand with the new funding that we will be receiving. So keep in mind, we're still brainstorming at this point. We haven't finalized plans for how the new federal funds will be spent. We have 60 days to submit a budget to the federal government. I want you to know that one of the unique features of a federally qualified health center is that we're governed by a consumer majority board. The majority of our board are actually patients of the facility. And the patients we serve will have a voice in how these funds are spent, as long as it's in line with the federal guidelines. So while we can't say exactly how we're going to spend the additional funds over the next 2 years, one thing's certain. We're excited. We look forward to the opportunities that the new federal funds provide, and we want to express our sincere appreciation to Congressman Yarmouth and all the members of the Congress that voted in support of the American Rescue Plan, and certainly to President Biden, all those that made this possible. So thank you for being here today, and we look forward to future announcements about how we will spend these funds. Thank you.
Thank you, Bill. Next, I have the pleasure of introducing someone who came to Louisville somewhat recently, July of last year. He picked a good time to join the Shawnee Christian Healthcare Center, but he's hit the ground running and he's providing great leadership there. The CEO of Shawnee Christian Healthcare Center, Stan Wardlaw.
Good morning, everyone. First and foremost, on behalf of the Shawnee Christian Healthcare Center Board of Directors and the wonderful staff that I have the pleasure of serving with, we want to thank Representative Yarmouth for supporting community health centers. Since I have arrived in Louisville, July of last year, his office has reached out to me numerous times to see what assistance they could provide to me. Also, I want to thank Mayor Greg Fisher, as several of his departments have been real responsive to our request. One of my board members is here, Representative Pamela Stevenson. I really appreciate her. She is responsible for bringing me, one of the persons responsible for bringing me to Louisville. I just leaned over to Bill and said, if you have trouble spending that $8 million, I can help you. We are I consider us to be the baby of the group. Thus, we got 1 million, a little over 1 million, but I tell you, we are very appreciative of that. Shawnee Christian Healthcare Center sits in the Shawnee neighborhood's heart with about 12,000 residents, of which about 91% of those residents are Black. Our area has been hit with COVID infection and a high mortality rate. As my heart grew weary looking at the numbers, losing friends, staff getting sick, and waiting on vaccines for our community, we learned recently that we have been allotted a federal shipment of vaccines. And then the joy really came when we heard that we were getting over $1 million from the American Rescue Plan. This funding is God sent, because we plan to do what we could not do originally. You know, we are a small health center, and a lot of my staff were willing to go out and volunteer their time to ensure that our patients are safe, to ensure that our community gets vaccinated. But we are most appreciated that this funding came through, and we're really appreciative to the Biden administration. The funding allows us to expand our workforce to treat our vulnerable patients and outreach to our communities. Our health center is vital to the community because our patients know us as a quality healthcare provider, and they trust us. Trust is critical right now as the Black community is hesitant about taking the vaccine. So one of the plans that we have in store for our community is to build trust. And the one way that we will build trust is we are going to put boots on the ground. We're going to do it the old-fashioned way. We're going into the community. We're going to do door to door. We're going to be walking the streets. And my vision is that we are able to provide vaccines in people's homes. This funding will allow us to do more COVID testing, to also increase our vaccine sites at 10 of the schools that we have, 10 school-based sites throughout the West End. Once schools are fully back in August, we plan to use funds to expand our clinical and dental services to keep our future safe. Our future deserves it, and we plan to do it. We plan to help our community as much as we can. So once again, I want to thank Congressman Yamath for all the support that he has provided our community. Thank you.
Thanks, Dan. Now I get to introduce someone whom, for anyone who knows her, knows she is a true force of nature, someone who has been the indomitable leader of Park Duval Health Centers for many years, and I've had the honor of working with her, but also getting lobbied by her a lot, and she's very, very difficult to say no to, and I try never to do that. So I'd love to introduce Ann Higgins-Grigsby of Park Duval.
Good morning, everyone. I didn't write a speech. I'm just going to talk to you about what I see and take off this mask. Thank God. I am so looking forward to not having to wear a mask sometime soon. This allocation of $4,352,250, I'm going to cry. That's about 80% of our federal budget. That's 80% of the amount of money that we normally get in 1 year from the federal government. Congressman Yarmouth is a staunch supporter of community health centers, and he's our advocate on Capitol Hill all the time. So we're grateful for this bipartisan support, because they understand the needs that we provide, the needs that we answer. Mayor Fisher has always been a partner with Park Duval Community Health Center. He was at our 50th anniversary celebration, where the first CEO of Park Duval, former Mayor Harvey Sloan, was present. He is still alive. He's 83 years old. He's in Washington, D.C., and he's going to call me about this tonight, because he does call me in the middle of the night. But I am grateful that he's still a staunch advocate for community health centers as well. Park Duval Community Health Center is named Park Duval after neighborhood. However, there's a misperception that we only serve Park Duval. Only 27% of our patient population is from zip codes 1011 and 402, 1011, and 12. We actually have clinics in Park Duval. We have a clinic in Russell neighborhood. We have a clinic in Hikes Point that's called Newburgh, which is going to be moving to a brand new building later this year. We have 2 school-based clinics at Central High School and at Pleasure Ridge Park High School. But we also have clinics people don't know about. We have a clinic in Henry County. It's in Newcastle, co-located with the Henry County Health Department. There is no hospital in that county. There are no dentists in that county. We have a clinic in Taylorsville, across from the Taylorsville High School, Spencer County High School. There is no hospital in that area either. I mean, I want vaccines to flow like water downhill. We had a patient drive from Glasgow, Kentucky to Louisville to try to get vaccine at our main site. So when we look at the need, yes, we need it in the West End. I mean, a large percentage of our population in the West End do not have access to vaccines, not because we aren't trying, because all of us are working together with the hospitals and church-based groups and each other and the health department to make sure that vaccines are available to our communities. However, those social determinants of health that everyone's been talking about are the things that impact our patients' inability to get the health care they need, to participate in school programs with their kids because they don't have transportation to get there, to have adequate food every day so that they are not hungry. So we have to address all those problems, but the vaccine, if we want to do it hastily, if we want to do it fast, we have to do as they said and make sure that we take it to where the patients are. I mean, I have a mobile dental van. My mobile dental van has gone to Safe Place and to the YMCA, Safe Place, and Family Scholar House. We've been giving vaccines. We started that this week. We only get a small dose, though. We get 100 doses a week. With my 50 and over population is over 6,000 people, so it would take a lot of weeks if we only got 100 doses. We have been approved now for the federal allocation for all of our clinic sites, including our rural sites in Spencer and Henry counties. So this money is going to go to help us with providing service to additional people, additional staff, We need additional vans. We already have a fleet of vans that take patients to and from their appointments. We've been doing that for over 40 years. You know, this is a time in our lives where we can make a major difference in people's, not only their lives and their livelihoods, but their health, and decrease mortality. People should not be dying because of something that we can prevent if we can give them vaccines. Healthcare is a right. It's not a privilege. And these funds will help us to address that and make sure that everyone has access to quality health care and vaccines in our community. We thank everybody for their support and for their continued prayers. And my hope is that by the time I retire at the end of this year, this is over with and I can stop wearing this mask because I'm really, really tired of this. Thank you all very much.
First off, from a professional level, I'd like to just say that we have a modern miracle before us. Vaccines that have been developed in record time that are able to help the body defend against this virus. And it's the single greatest mass vaccination project of this generation. We're currently getting 600 doses a week from the state, first and second doses. And I'm very happy to say, as long as we've been doing this, we've not wasted one single dose. We're getting those doses into arms. We're getting the vaccine out there into our communities. And even though 600 a week may not sound like much when compared to the mass vaccination sites, I'd really like to emphasize this is being done during a full day of seeing patients and filling prescriptions. So it may not sound like a lot, but it really is. And doing the job that we need to do and vaccinating these people. This extra funding will allow us to increase staff to get more shots into arms. We'll be able to fund extended hour vaccine clinics at our sites. Our clinics that are located in historically underserved areas where education and outreach will have the greatest impacts. We're using that established trust that's been forged over years within the community to encourage the vaccinations. Our patients may not know Dr. Fauci, they may not know Dr. Stack, but they know Dr. Jackson, Dr. Bella, and Dr. Feynman. And that recommendation from a trusted healthcare professional goes a long way. It helps convince those people that might be on the fence that this is something that is good for them and good for everyone around them. We're also reaching out to those patients who may not have a vehicle to go to those drive-through vaccination sites. Now, our clinics are in these areas that, public transportation may be the only way people can get around, and they can walk to our sites. Our outreach services have gone to numerous shelters and homeless encampments to help those populations, which with such success it has actually eclipsed the immunization percentage of the general public. We are dispelling the vast amounts of misinformation circulating about the vaccine. We're reinforcing its safety, its efficacy, and its need. Population immunity can only be achieved by getting the hesitant to adopt the vaccine. We have to strive to do our parts for the greater good of everyone. The vaccine doesn't only protect the recipient, but all those around them and all they come in contact with. These funds help to strengthen the mission of family health centers and all community health centers to improve and promote the public health. Thank you.
We're going to open up for questions now. I just want to say one thing. I hope that this presentation gives you a pretty good picture of the magnitude of what these organizations do and how much these funds can mean to them in their mission to serve our underserved population in Louisville, a job that they do well, again, 365 days a year. But we know that the pandemic struck inequitably, and this funding is designed to help balance the scales a little bit. And I, once again, want to thank all of them for what they do every day.